One global health initiative of the New England Annual Conference's Nicaragua Covenant is the Amanecer Mobile Health Clinic. Many New England churches are not familiar with the programs of the Nicaragua Covenant that assist the Nicaragua Church of Christ, the Evangelical Methodist Church, and NITCA. The conference's 3 sewing programs teach a skill to 150 women a year, and our Covenant lunch programs feed 300 children in 6 communities. Education programs fund teachers in 6 primary schools and provide 47 secondary and college scholarships. We also have begun clean water and sanitation projects that begin to address the underlying health issues in the communities. We invite you to come and see these programs firsthand as part of a 6 to 10 person delegation to Nicaragua. The Amanecer Mobile Health Clinic was expanded in 2007 to operate 6 days a week, serving 72 geographically remote communities and visiting each community once a quarter. Donations from the Together for Tomorrow campaign bought a used truck, allowing us to travel to more distant and difficult locations. Visiting a different village each day, 6 days a week. Our truck had to be replaced in 2010, and the new truck was funded by the Foster Lynn Fries Foundation. Because medical and dental care are not available in many rural communities, women like Maria walk for hours from neighboring villages to bring a sick child to see our doctor or dentist. Patients line up to see the doctor, who typically sees 95 patients each day, or 29,000 patients in 2010. There is no charge to the patients, yet many express their gratitude with a simple piece of fruit. Our focus is on diseases identified by the World Health Organization for Nicaragua, including acute respiratory diseases, diarrhea, urinary tract infections, parasites, and anemia. Without a drill, our dentists are limited to extractions and cleaning teeth. They cared for 4,900 patients in 2010. The communities reach from the mountains near Honduras in the north, down to Costa Rica in the south, and east to the South Atlantic region. Roads outside Managua are poor, and to reach 16 communities, the team must walk the last mile or so. In San Juan del Rio Coco, Carlos was in the Sandinista Army and Omar in the Contra Army. They were deeply thanking us for the clinic's support, saying that we are the only group who dares to drive their roads. Carlos added, "Now the war is not among our brothers, but our war is against the diseases, so we are now the health army for our children." The doctor will write prescriptions that our driver will fill based on medications we have available. Our pharmacy is at Casa Amanecer in Managua. A $10,000 medicine budget meets the basic needs, but if expanded could treat additional illnesses. Christian Aid Ministries provide supplies and non-prescription medications to 24 clinics in Nicaragua. According to CAM, the AMHC is the best mobile health clinic they know of in Central America. The doctors keep detailed records, and we track effectiveness to understand how New England's clinic can make a greater difference to the rural poor of Nicaragua. This analysis pointed us to the underlying problem of contaminated water and inadequate sanitation. The clinic consists of a truck and 2 teams, consisting of a doctor, dentist, and team driver. If one person is sick or not able to go out with the clinic, we have trained backup staff ready to go. In the very remote village of Cana Adolfo, a lovely senior woman, Dona Mercedes Reyes, she told us, "This ministry that you carry on is one of God's miracles to benefit us, the poor in Nicaragua, because we are abandoned here by the government, and you give us hope and free medicines." Beginning January 2011, the clinic had to reduce the operation to 5 days a week due to financial considerations. We invite each church and its members to donate just $200 each year through your mission budget to the conference account 803 Nicaragua Covenant Global Health, so that with help from our churches and members, we can return to operating our mobile health clinic 6 days a week and expand available medications for the poorest of the poor in the Western Hemisphere. This DVD is available in your annual conference welcome packet and can be viewed on the conference website at www.nicaraguacovenant.org/clinic.